1 billion people, or 15% of the world's population, experience some form of disability. 80% of this are in the developing world. This is according to the World Bank. In Kenya, 0.9 million people, or 1 in every 16 people, were reported to have some form of disability in the 2019 national census. Persons with disabilities, on average as a group, are more likely to experience adverse socio-economic outcomes than persons without. Yet, the achievement of Sustainable Development Goals and SDG Goal 10 in particular on reducing inequality within and among countries relies on the involvement and inclusion of all. With COVID-19 providing the need for creativity and innovation as a response and recovery from the pandemic, how do we explore solutions to problems facing the country while leaving no one behind? Regina Chumba is a woman with a physical disability living in Eldoret town of Uasin Gishu County. As a person with a disability, Regina faces challenges.
As a woman with disability, there's a lot of discrimination that comes with it. One, in social life, supposing you're dating a man, I'll always be asked, what have you seen in this woman? And I like my life experience where I was taken first, the father to my children. The mother-in-law asked him, of all the women, was this the only woman you saw? So there's a lot of discrimination and stigma that comes with the disability. So if it comes to business, people don't believe that we are just like any other person. They also believe that what we sell is substandard. It's not like what the rest are doing. There's a lot of discrimination. And also if it comes to employment, whenever you attend an interview, they'll always ask you, are you able to do this? And even at some point, you'll be asked to remove your shoe, to check if you are really able. Can you work if that office or wherever you are going, the service that you are getting from there, if the place is not disability friendly, you'll always be discriminated because they will believe that you'll always complain.
But when she was introduced to the Center for Human Rights and Mediation, a community-based organization that helps the poor access justice, Regina's life changed.
When I joined CHRM, I was able to come out and accept myself, and I was able to fight to come out. And I've also worked to help others to accept themselves, those women with disabilities and also men with disabilities. So life before was a life of unacceptance. But now I've accepted myself. I can do anything like any other person.
We are undertaking a program supported by UNDP Kenya on access to justice under their PLEAD program arrangement, where we are trying to enable the indigent community, that is the women, the people living with disabilities, and the poor, to access justice through either alternative means or as aided persons through the judiciary. One of the paralegal that we are really proud of is a paralegal that we trained. One, she's a woman. Two, she's physically disabled. And three, she's a hawker. These are people who are facing confrontation with the county government enforcement department all the time. They assign them places to sell their wares in the morning. In the afternoon, they're there chasing them away. And you know, they can't run. They confiscate their wares. They take them to court. This person is forced to go through the judicial system. And after the judicial system process, they never get back their wares. What we realized is that they also didn't have information. They didn't have the background legal information to assist them defend themselves. So we picked a disabled person, a person with a physical disability, to train a woman to train as a paralegal.
We have a lot of challenges as a community of business persons, like the Kanjos, the county askaris. We go through a lot of them. Sometimes they even assault. Like this business, they sometimes threaten to destroy even this building. But since I know my right, I've always followed the law to where it's supposed to be done. And also, I've also empowered other women with disability. I've told them this is right and this is wrong. So long as you're not selling in front of someone's shop, and you have children, you're a mother, so it's your right. So you should not be intimidated. Yes, sometimes there's a lot of intimidation, but we have to fight and come out like any other person. We have to be strong.
Wow, today we are in Malindi, Kilifi County, an area called Shela village in Malindi, and I'm so excited because you're going to meet a lovely lady. The lady is called Valencia Bosibori, and Valencia is a lady with albinism. We want to find out her journey. She's an amazing lady and we want to listen to her story. So let's go ahead. I'm told she's at a kibanda somewhere buying some nyanyas. Let's go and find out. Unlike Regina, Valencia has had a supportive environment.
Huwezi kosa ile, like the society don't really understand what albinism is, why this kid is born white, when the parents are dark, the siblings are dark, Definitely kuna ile society bado hawaelewi. And then kuna zile little discrimination too. You find people maybe talking kwa barabara, oh mtoto wa nani, I don't know what, hiyo ni kawaida. But from my family, I don't remember any time I maybe faced discrimination, people discriminating my parents because they have a different kid, Yeah, and I always actually thank God.
And that supportive environment has opened many doors for her. She works at Safaricom, while she also creates music. In addition, she takes part in beauty pageants and is a former Miss Albinism Kenya. Do you think your upbringing and how your parents just brought you up confidently and the schools that you went to contributed to the woman that you became eventually?
Yeah. Because upon the nilipata, that's where I discovered that I can do lots of things. Na nilipata moral support, na like ikanipatia motivation to self-esteem, yeah? Yes, that's why I got self-esteem. Because ningekuwa discriminated, not being supported, yeah, from a kid, then hata ningekuwa na self-esteem ya hata ya kuongea mbele ya watu.
Kwacha Africa is an organization based at the Kenyan coast that targets the youth and focuses on 4 thematic areas: peace and security, gender, health and disability, land and environment, and theatre. When COVID-19 came calling in 2020, persons with disabilities found themselves again disproportionately affected. Organizations like Kwacha Africa played an important role in disseminating COVID-19 related information.
In these programs, we are focusing on also to bring on board the people living with the disabilities, and it's because most of the time these people are being left out in programming. So for us, we see this as an issue, and our main reason of bringing them on board was not to bring them as separate participants, but it was like inclusion, bringing them together with the people who are not disabled to discuss these things. And a lot of things happen during the discussions, because also the people living with a disability, they will bring their own issues, what they feel about the issue of coronavirus. Also they have, you will force them sometimes to, because like if I want to invite someone in a forum who is living with a disability, the cost of bringing that person and the cost to bring somebody who is not disabled is very differently. And that's why people have been leaving these guys out. like the issue of also corona, there's a lot of things which these people, some of them, they have to walk in pair, either to push another person or to shake a hand of another person, those people who are blind. So for us, those are the challenges which we were trying to bring them on board and discuss with them, even together with the police, so that they can be understandable on how they feel about their situations and all that. The project in Malindi for UNDP, this project mostly was focusing on empowering the community and the youth on issues of COVID-19 and human rights issues, because there were some cases of human rights violation within the COVID-19 implementation rules from the Ministry of Health. So for us, what we were doing was to bring the security agents plus the communities to discuss about how the community can take care of themselves through following the protocols which were set by the Ministry of Health, plus also the police focus on the human rights issues instead of violating or harassing people. I think we were discussing about how we can take a smoothly discussion so that they can, even the police also can educate community on the same rather than harassing them. So it was more of coming up with a way of how we can work together with security agents and the community at the same time understand the rules and regulations, so that also they can stay away from being infected by coronavirus.
Kikundi ama shirika la Kwata lilipotufikia, walituhamasisha, watufunua macho. Zaidi ya yote ni kwamba, kwanza kabisa jambo la muhimu ni kwamba tulikuwa tukienda katika mikutano, tulikuwa saa nyingine hatuwezi kujua zile precautions ambazo tunafaa kuzichukua tukiwa katika mikutano. Tulifundishwa na tupitie shirika la Kwata. Tena jambo lingine ambalo tulipata msaada kwao ni kwamba walitukaribisha zaidi karibu na serikali kuu na serikali ya county, na kwamba tukapata platform ya kuelezea mahitaji yetu, na pia tukapata platform ya kuelezea zile ambazo ni issues zetu. Na pia jambo faida nyingine ambayo tuliona tulipoitwa na shirika la Kwata ni kwamba tuligundua kwamba kama tuko na uwezo mdogo, na kwa niaba wale ambao hawana uwezo, sisi ambao tuko na uwezo kidogo, hata tukienda kwa mkutano ni vizuri tuongee nao, kuhamasisha kwamba hili gonjwa liko na mambo ya kufanya ni haya, kama kuvaa mask na kunawa mikono. Saa nyingine hii information ilikuwa haiwezi kuwafikia, lakini sisi tulipoitwa kama viongozi tulipata information na kuwapelekea wale wenzetu tukaenda kwa mkutano.
Mambo yalibadilika. Tuliona usalama sahihi umeanza kuimarishwa. Pia tumeona baada ya kuwa washatufunza watu wa Kwacha, tumekuja tukapeleka hiyo ujumbe kwamba unatakiwa uvae mask, unatakiwa at least usalama uimarishwe upande wa disabled, na mtawachukulia kwamba wasiwe, yani msiwaharas. Pia naona sahihi umekuwa umebadilika. Pia tunashukuru kwamba sahihi, yani hiyo watu yani hali inakuwa ya kawaida. Pia uchumi pia tunaona kidogo umeanza kurudi kidogo.
When that COVID-19 pandemic was announced, immediately PWDs ran away like lightning. They went home. Those who had businesses, they were told, this thing is very dangerous, so you must hide. Everybody hid in the house. But now the problem came. Some of them did not have anything to eat. Some of them who were living in rental houses, they were chased away. Some of them could not even afford sanitizers or masks, and so forth. But we wrote an emergency proposal to UNDP Kenya, and through the Japanese embassy, they were able to give us 2,174,800. This money, when we got this money, one, we started addressing the issue of economic empowerment. So that's where some of them said they want to start rearing chicken. We bought them some chicken. Others started making kiondos, weaving. They started weaving. Others started selling soap. Others started selling masks for income generating. Others started even making mats. And up to today, I can say authoritatively, they are working very hard and they are doing, getting something.
How has CHRM engaged the county in helping persons with disability access justice?
Okay, as HRM, okay, that is a general organization, but personally I work at the county. Okay, my work is to mobilize the deaf at the county government and go for the trainings, and that will help the deaf who are working inside. When they go outside, they'll be able to know their rights and to defend themselves outside the county.
Okay, how's that collaboration helped you as staff at the county government so far?
Okay, as HRM have been lobbying us during Corona time. When it was they asked the county government to support the deaf with the masks, soaps, and sanitizers. That's what they lobbied us.
It's such collaborative and innovative ways of tackling the challenges brought to the fore by COVID-19 that will be important in recovery and building forward a better and inclusive society.
Every 5 years, the UN and the government agree on a series of priorities under what we call the United Nations Development Assistance Framework. And what this responds to is directly the national priorities as articulated in the various development plans, Vision 2030 of Kenya, the Medium-Term Plan 3. The current UN Development Assistance Framework runs from 2018 to 2022, and focuses essentially on 3 broad pillars. The first one being transformative governance.
When we talk about the partners, I wouldn't want to say just it's international partners that contribute towards making sure that we target the most vulnerable and work for them. We need to ensure that we're working closely with governments so that their budgeting, their planning, their resource allocation is focused on the most vulnerable, and that means working on the social and human development aspects. We need to make sure that the private sector is bringing in those resources and the capacity and the innovative financing that can truly make an impact on people's lives.
We know that people with disabilities face different challenges when it comes to accessing, whether it's healthcare, education, employment, information, and different opportunities and services. And this was only made more apparent during the pandemic because of the different movement restrictions and different measures that were put in place to minimize the spread of the pandemic. And then on the flip side, you see that Kenya is recognized globally as a hub of innovation, and yet the innovation space is maybe not as disability inclusive as we'd hope it could be. And so we're hoping to see how can we connect the 2 dots and seeing how we can use disability inclusive innovations to kind of drive some of those solutions that are addressing challenges faced by people with disabilities, and in that way be able to amplify homegrown disability inclusive innovations and find ways of supporting some of the innovators working in Kenya, working in that space, and hopefully use this as a jumping off point to take this further, whether that's bringing in other partners and other networks to see how we can move the conversation further. From the applicants we got, we were able to select 5 finalists, and those are the teams that we've been working with over the last few months to test and prototype some of the innovations and see how we can potentially scale the impact of the solutions that they have. So even as we are thinking through, how we are designing innovation challenges, how can we make sure that we're expanding the scope of the people who are accessing these different opportunities so that we are not missing out on some gems that may be out there that we just may not know of them yet.
Most importantly, at UNDP Kenya, we are taking the approach of integrated programming. So beyond the transcending foundations of peace, we have other interventions. And our inclusive growth portfolio, we have projects that really respond to skills development for young people, for entrepreneurship, skills development for employability, but also most importantly for innovation, so that the young people can be able to be at the forefront of innovating ideas to address the real development challenges that we face.
The need for partnerships among stakeholders and an integrated approach to fostering inclusivity, especially through use of technology, cannot be undermined. For example, in the area of education, employment, healthcare, and access to financial products, use of assistive devices and inclusive access to digital platforms will be key in fostering inclusivity.
We can actually call for a competition of innovation that is disability specific. So these are some of the things that actually moving forward we should be able to do so that we create more awareness and we give more opportunities, so that we give more opportunities for persons with disability to explore their potentials and to actually see what they can provide in this space.
If we can push to get digital products and services accessible to people with disabilities, one, they will benefit everyone, meaning they'll benefit people in low bandwidth areas, they'll benefit people whose English is their second language, they'll benefit employees who have disabilities and they don't talk about them because 70% of disabilities are hidden. We can be 10 of us in the room. How do you know I have a disability if I'm deaf? You're not going to know. So 70% of disabilities are hidden, but where we can make the biggest impact is by changing our products and services and realizing they benefit everyone. And for the employer, that's an untapped market that if you make your products accessible, you will be actually hitting a 15% of the population that currently doesn't have access to your products.
And these partnerships are already yielding results.
Innovate Now is an initiative that came as a result of the Global Disability Summit that was held in 2018 in the UK. And the government of Kenya committed to really advance the agenda on bridging the gap for disability inclusion in Africa. So we set up the first assistive tech accelerator in Africa to support innovators who are building technology, both low-tech and high-tech, to support persons living with disability. What we've done is we send out applications, a call for application to innovators out there who are building certain technologies for persons with disability. We shortlist them, we interview them, and then they go through a 12-week program. Initially, this was fully in person, but when COVID hit in 2020, we shifted to having it be fully virtual. So it's all carried out virtually. And they go through a curriculum that we've built to help them understand who needs the product, what is the product, how big is the market that needs to consume this particular product, and how can they build a business around it.
Technology is a very important equalizer in terms of spurring inclusive education. How? does it contribute? For example, visually impaired learners and trainees have a challenge of access to books. For many years, the communities of visually impaired people in the country have had challenges of accessing Braille books. Books in Braille are very expensive. For example, let me tell you, one book in Braille costs 5 times the ordinary book in print. We have since digitized these books and ensure that they are available in, digital access information systems, what you will simply refer as DAISY formats.
Our current constitution, as we always proudly say, is the most progressive, and issues of disability is captured right there, especially in the Bill of Rights. There's also political right, there's economic right, and many things. Maybe people can argue that implementation is taking us a long way, to actualize the gains in that constitution. We have also ratified and domesticated Convention on the Right of Persons with Disability, UNCRPD, as communities of states or membership of the UN agencies. So in terms of law, other countries are also benchmarking with us.
Sasa hapa nimeandika man and his environment.
Despite the efforts, barriers to disability inclusivity still exist, and the solutions lie within us.
Disabled people are the poorest, yet their lifestyle is the most expensive. And their own lifestyle is then an economy in itself. And as a country, we have to now come up with programs that see disability lifestyle itself as an economy itself to be exported to other countries. I will give you a very simple example. If we take a remote figure of 1 million people, according to estimate of World Health Organization, that uses wheelchair, the simplest or the cheapest outdoor wheelchair you see here costs about 30,000. This disabled man or woman cannot afford. So 1 million times 30,000, that is 30 billion. So 1 million Kenyans are sitting on a metro worth 30 billion. This now excludes, the manufacturing, the employment it creates, other fringe benefits like transport, warehousing. What affirmatively goes to us as a disabled person is way below or inferior to what the lifestyle of disabled people generate as an economy. If someone is blind, they don't use this pen. They use softwares like JAWS, and it's expensive. Hearing comes with a lot of money. Crutches. So we have, in developed world, you see certain region exporting service of disability. So those are the narrative change around which we want to project to tie the issue to issues like manufacturing agenda in the government.
I think the first barrier is really to recognize that this is needed. That this is not a minority group that has no abilities and nothing to contribute with in society. To just change the mental sort of perception that these are not people who are a burden, but these are actually people who can contribute in society and want to contribute to society.
We need to ask the government or any other private organization to make every place accessible for persons with disability.
And also we are asking the private sector to be inclusive, because we are just persons like any other person. So we shouldn't also be only pushing with the government, but also in the private sector. Whatever you are doing, like myself today, someone had employed this person with disability, is away because of COVID. I had employed a deaf person, I had employed a blind person.
We've been in the coastal region documenting stories of persons with disabilities and the challenges that they've been facing, and the challenges and possible solutions actually to some of those challenges. And one thing that has really stood out is that some of these challenges and concerns cut across, from the coastal region to Nairobi to other areas that we've been to. You realize there are some issues that have been raised that actually cut across. Like the issue of getting a disability card. Like it's very hard for persons with disability to access the card. because they need a lot of assessment. They need assessment, and sometimes some of the specialists that are supposed to assess them are not even within their reach. So this is actually a call from them to policymakers. If they can be able to access this card more easily, then it would be quite a relief to them. It has been a journey, and the future looks bright if everyone is on board.
There's always hope, because 10 years ago we cannot proudly speak about disability like we're doing now. We cannot go and sue, litigate institutions, individuals, by virtue of being locking you out because of your impairment. So, you know, there's always big hope. We don't lose hope. And we are trying to embrace, and the narrative around disability change we're trying to push is, disability is not about individuals' impairment. No, it's about the barriers across individuals with impairment.
With the many barriers to disability inclusion, and especially in the area of innovations, public awareness on disability, deliberate partnerships between stakeholders, civil society organizations, government, non-governmental organizations, corporates, development agencies, and engagement with persons with disabilities will be key in realizing a truly disability inclusive society.